I go to the ER again for a scenario. I had just severe pain to where I was almost throwing up. I had sweats, was ready to pass out, and at least this time I was prepared to take another pregnancy test. Those came back negative, no surprise there, and I sent to get another pelvic ultrasound. They spotted a small cyst and nothing else, and I was just told to schedule a visit with my OBGYN. In 2006, I was actually lucky enough at that time to have a doctor who took my pain seriously, and she pretty much said that she thinks that my pain was endometriosis, but the only way to know was to have surgery. So, of course, I was willing to do anything at this point, and I said, go ahead, I want to figure out what's wrong with me. So she confirmed I did have it, and we performed a laser ablation surgery. The surgery was a success, felt really amazing after, but then 3 months, all the pain came back with a vengeance, and it was actually worse than how it was before surgery. 2013, the pain just continues to get worse. Quality of life is just kind of crappy. Like, you just feel sick all the time. You don't really want to do anything, and like at the point that I'm 2 years post-surgery and my symptoms become worse, so this just must be it is, and I'm going to have to figure out how to deal with this every day. My hip ached, my stomach was distended, wearing pants hurt, it hurt to stand up straight, sex was extremely painful. I pooped like once a week if I was lucky, so that obviously caused problems on its own. And when surgery was only 3 months of normalcy, I kind of gave up, and so that was kind of just a not so time. And in 2013, I couldn't hide my pain from people anymore because they started noticing that my mood had changed. I didn't want to do things anymore. I let my husband know that it was actually worse than he thought, and he said I put on a pretty good show because he had no idea that I was in that much pain. He threw out everything we had known about endometriosis. He started researching for me, and he found out about excision surgery, where they call the endometriosis tissue, and he started searching surgeons. We were lucky enough to find Dr. Sechkin, who's in New York City, where I am, and we have a consultation, and the first consultation was exactly what every woman deserves and needs to hear. He asked me questions that no one else had asked me, and I knew that he understood what I was going through. He asked me how many times I had a bowel movement, was painful, was it sit, just things that no one ever thought to ask. And so I'm like, okay, he really gets it. And this is strange too, but he performed what I call the most sympathetic ultrasound, knowing how painful they are for women with endometriosis. He completely stood, and he made it very quick and as pain-free as possible. So I went ahead, had surgery with him. It was over 5-hour surgery. I shared the video of cutting all the tissue out. It was really cathartic seeing it, and it made me feel like I wasn't going insane, and I felt like we got it. And 2016, I had identical twin boys, Jack and Finn, and I became pregnant with them at the ripe old age of 38, and during our ultrasound, I found out I was having twins, so that was pretty exciting news that I was able to get pregnant after all of this, and I actually still feel really amazing after the surgery and pretty much symptom-free, which I wouldn't believe, but it's true. This wasn't just my problem. From being pregnant, I realized there's so many resources, there's so many apps out there, and there's about 6 million U.S. pregnancies each year. We'll come back to 15 million women who suffer from endometriosis, and then if we're saying that 1 in 10 women have endometriosis. So it just feels like what support is out there for women like me. I started looking at things that most women don't know, or family members don't know of women that have this. 1 in 10 women have endometriosis. It takes 10 years on average to diagnose it. And it costs society $119 billion every year, and that's considering loss of work, days that you're losing jobs, productivity levels, everything that goes into that. And the current chronic pain can indicate an underlying disease. There are medicines and procedures to reduce the pain. Tracking specific cycle symptoms can speed diagnosis. And there is a community of women who can help. And these are all things that I wasn't aware of when I was going through all of this. So I just wanted to point out that there is hope. So as a developer, my husband and I own a firm together. We always look for useful apps out there, just because there's usually something for everything. And this surprised me that there weren't any useful apps for the million women that have endometriosis. I tried other period tracking apps, which were good, but the symptoms were really light. They were bloating, crabby. They were just kind of like, they didn't apply to me. They didn't apply to the severity of pain I was having. You know, I had stabbing, twisting, pulsating pain on my left side. There wasn't any way to track these specific things to my doctor. And I wanted something because every time I go to the doctor, every time I can never answer the question of when was the first day of my last period, let alone like each symptom that I was having on the entire day, because these symptoms weren't just happening on the days that I was having my period. It was happening every day. So I kind of like put this little grid together, being a developer, of what these other apps are in terms of functionality. And went in and looked at the things that I really wanted. I wanted it to be free. I don't want people to have to pay for upgrades or certain things to track. I mean, periods are expensive enough. Dealing with endometriosis is expensive enough. I don't think you should have to pay for an app. So that was really important for me. Flutter Community was really important because while being pregnant, I found like the app was super helpful, and like women offer advice that are in the same exact situation. I joined a twins group when I was freaking out, finding out that I had twins, and they can like mind in a couple comments saying I've been there. So I wanted the same thing for the endometriosis community. The symptomology tracking is really important because doctors can start seeing patterns within 3 cycles that point to something that they need to take more seriously and check out. The export PDF is everything that you track in your app. You can print up or email to your doctor to share with them. There's a self-diagnosis tool, which I think is pretty cool. It can scare some people, but I've had friends say like, oh my gosh, I took the self-diagnosis and it says I have it. It's not given, you know, to give you a diagnosis, but it's more to lead you to talk to you about certain things. These are all like key symptoms that doctors look at, specialize in endometriosis, that, you know, if they see a few of these put together on, you know, that you're checking off, it's gonna point to some sort of diagnosis. There's a doctor finder. It is a basic period tracking app, and it has ovulation tracking. And then we added in there some women's health content, things on management, nutrition, some meals, and the app was born. These screenshots of the app that we put together. The features are, you know, there's a section to learn more about endometriosis, which is actually really helpful to talk to your family members. You know, I brought this to my mom, and she felt really bad. She didn't know any of this was going on, but it's a good resource to kind of explain to people what it is. There's the self-diagnosis test in there. Everything I kind of listed, there's a medication log, reminders and alerts to remember to take your birth control or whatever medication that you're on. And we did recently add wallpaper just for a little fun because you want to be able to personalize it. This is the thing I'm most proud of, and that we added recently is the community to the app. This is basically, you can add a new story, and there's different groups. There's like pain management, there's menstruation, and it's there for women to talk to each other, to ask for help, say, has anyone gone through this? I see a lot of women in there posting, you know, for their first surgery, what should they be prepared for? What should they bring? What should they do? And really there's a a lot of like younger women in there asking about things that they're experiencing with their period really early on. So I find that really because just love that it's a positive environment and women are trying to help each other go through this journey. The food bowl is another thing that I added. Just from personal experience, I have been vegetarian since I've been eating. And I thought, I eat really healthy, I have a great diet. But what I didn't realize is that all the dairy I was consuming is not helping an inflammatory disease. It's not how you feel better. It's not the best thing for me. So I actually went plant-based. I actually right after the surgery, and that alone has really taken away the symptoms for me. My bloating was gone immediately. I've just stuck to it because I feel like I've never felt better with this diet, and I want to inspire women to try this. I mean, if they don't want to go plant-based, that's fine, but if you start logging the food that you're eating, you're going to start seeing what can trigger your symptoms. A lot of times women will say, I had some eggs, and the next day I was in severe pain, or, I had a really bad stomach ache, I was really bloated. So this can kind of help you see what you could weed out in order to help you feel better. And kind of have my roadmap, like what I want to do with that in the future. I really want to put in a section on discounts for products for users. I've seen a lot of apps before, but I think it'd be kind of cool and something that's well-deserved for this community that's going through some already to have discounts at some cool companies, or, some like thanks, like certain things like that applies to your life, and it'd just be a fun thing to offer discounts and deals to users. And I'd also like to kind of spice up the profile features, definitely to engage a younger audience, because my goal is, what I hope is that younger women, younger girls can start tracking their periods right away, start tracking their symptoms. So like my generation, they're not going to have to wait a minimum of 10 years to get diagnosed. If they start having painful periods right away, they can talk to their doctor and hopefully figure something out a lot earlier. And things that I thought would be cool to add are like in-app and messaging, so women can talk to each other outside of the community. Little emojis, wallpapers. We did add the wallpapers. That was cool. And like little profile badges that women can use. And with Flutter, I found there's like such an amazing community of female healthcare companies, not only just apps that I'm really trying to do partnerships with, because there's a crossover in every single one of these sections. And the more I talk to, and these are all actually women-led companies, which I find really awesome. But there's a phase in a woman's life where she's pretty much really going through all of these things at a certain time, and especially like painful periods overlaps all of this. So more and more I talk to women that run these companies, it'd be a perfect thing if we could all work together in this overlap and find something that helps a demographic. I have worked with, and I'm going to be working with which is a pretty cool app. It's for pelvic floor exercises, and so they want to do a feature on endometriosis and how they can try to help with physical therapy. And we're going to work together on creating some resources for that. And which is one of my favorite partnerships so far, is we partnered with Cellmatics, and the campaign is called Say the F Word. So this launched in January, and it's basically promoting women to talk about fertility of all different ages, because it's kind of this thing that no one wants to talk about, and especially women with endometriosis. It's a huge factor, and I think when I had had surgery. Alarming because I was in my early 20s and I wasn't even dating anyone at the time. And they asked me, you know, are you going to have children? Do you want to have children? And I'm like, I'm 20. I have no idea what I'll be doing tomorrow. And that was kind of what, like, one of the deciding factors if I should have surgery or not, because they were trying to preserve my fertility. And I think dealing with chronic pain and dealing with endometriosis and everything that comes with it, fertility is a really scary thing to start thinking about, and it's a lot of pressure. And it's kind of an insane thing to have to think about when you're 20. But this whole campaign is actually promoting women to talk about it, to empower themselves, to, if you go on the site, you can make a pledge. And my pledge was to talk to more women about tracking their periods and attention to symptoms that might indicate some sort of reproductive disease. And other women might that they're going to talk to their mom about their family history if there's anything they should be concerned about. It's kind of cool. You sign in, you make a pledge, and then $1 is donated to one of 4 different nonprofits. And there's giveaways on the site, and Flutter is actually promoting the giveaway is going to be announced February or early March, just because March is Endometriosis Awareness Month. There's going to be a nice, cool book feature about endometriosis along with the EFA. So if you want, it's all free too, so you can sign up for the giveaway. There's going to be, the first one is going to be an endometriosis package, and actually a lot of amazing women that were on that other slide that I showed were kind enough to contribute products for the gift. So I think that's a really partnership that I was honored to be asked to be a part of. One of the things that I've been super excited about was I joined the board at the EFA, the Endometriosis Foundation of America, and I think they do such amazing work. Dr. Suchkin is actually one of the founders of it, and it's really just a great educational resource for a lot of people. They do an amazing Empower program, going to schools and to young girls about their periods and things that they can do, and if they have painful periods, and different things to watch out for. And it's just it's really positive, I think, great environment to be around. And as I said, March, and I'm sure you all know, is Endo Awareness Month. So that means the Blossom Ball is coming up for the EA that I do every year, just to bring a lot of attention to the disease. And this year they're honoring Halsey, which I think is going to be amazing for endometriosis, just because she can bring a lot of attention to it. And really, I mean, she talks about it enough, but I just think it will help everybody. The more people that know about it, I think it makes it a lot easier for everyone. Another cool thing that they're doing, Patient Awareness Day, is Sunday, March 18th, the day before, and it's free. It's only in New York, but a lot of times they will broadcast and live stream a live list on their website. And I'm not positive they're doing that this year, but they do it every year, so I wouldn't be surprised if they don't do it. So I think it's pretty much my roadmap with Flutter and the history and how it's a thing. And I'm really so excited every time I see someone posted in the community that surprises me that women are using it, in the sense that it was like kind of baby, like something that I made. I honestly made it for myself, to use myself, but I know other women need it, and I'm hoping they're finding it as a great resource. And that's it. That's Flutter in a nutshell.
Thank you so much, Kristy. If you guys want to start put in questions in the Q and answer part, and I just want to say and thank you for how you helped the endometriosis community in such a tangible way. I think that's something that you built a tool for women to use, and with our first question is, what has the support been like in your life when people close to you heard you were creating an app about this topic?
Really amazing. I think it was like two things. I think a lot of people felt like, my mom especially, I think, felt really guilty and like upset that she didn't know it was as big a thing as it is. Like they're surprised that there are so many women that have it. I think when people start seeing the statistics, it really shocks them. And as far as like I've not seen more support from other women, just from a business angle too, and a health angle, that I became buddies with Jessica Murnane, who wrote a cookbook about wart plants. She had endometriosis, and she was on the verge of having a hysterectomy, and she was like, wait, that's the path I want to go down, and she tried the dietary, wrote a book about it, and so I became friends with her, and like the B. Wam, another friend of mine that makes Fertile Girl, she makes fertility bars, but like everyone has some story of someone with endometriosis, so I think it's a surprisingly easy way to bond with women, and especially because you just hear about it more, which is a real thing. It's everyone knows someone that has it, which is sad to say, but then it also bonds everyone together, and everyone really wants how much as they can, which is really cool.
Great, thank you. The next question is, do you have any advice on starting conversations about fertility in your real life with the people around you, specifically with men?
Yeah, I mean, I think just be about it. I think like fertility for some reason has such like a scary vibe to it. I think, I mean, I was super, super lucky. My husband, Jason, was actually the one that like forced me to do something about endometriosis and kind of like be proactive about it and to talk about fertility. I think he really urged me because I'm not sure that I would have done it on my own. But I guess the older you get to, maybe you're talk about it at a faster rate. But I think even being young, if I had started talking about my fertility and that and how endometriosis may or may not affect it when I was in my early 20s versus just being terrified from it, I think it would have lifted a lot of anxiety. I think if I just would have talked to mom or, whoever I was with at the time, or friends even, I think it would have lifted a lot of anxiety. So that's my advice.
So our next question is, I don't have endometriosis, but my daughter does. What are the best ways that I can support her? I just can't understand how this feels for her.
I was listening to her. I mean, my mom was in the book. She couldn't understand the extreme pain that I was in when I would describe it to her. And I think just listening is a huge thing because a lot with endometriosis, I think, are blocked in a way where they don't want to be, they don't want people to know that they're suffering. They don't want to kind of play that card like, oh, because someone will say like, oh, well, you just have a bad period. And you're like, no, it's not a bad period. It's completely different. So I think listen to your daughter. And I would advise her, I mean, if she already knows that she has it, I would really seek out a doctor that really understands it. Dr. Skin had, before we went with him, he had on his website, and I know the EFA has this as well, key questions discuss with your doctor. And it's a way to know if they're an expert or not. I think going to the doctor with her and all sitting down together, having that support system, I think is really, really big. And I think a lot, and just being and understanding. She's going to be really frustrated. And you come through the grieving stages, you're really angry and you're sad. And I think just being there through it all is helpful.
Great, thank you. So our next question is, does adjust as periods may be longer than 4 weeks apart from one another?
It does. Sorry, short answer, but
yeah.
And if anytime we actually had a few women that would email me, which I'm always like completely down for advice, things we've had. I haven't been able to update the app recently in terms of like different descriptions for pain, but I love hearing like what women need, what they want, and I want to add it as quickly as I can. So if there are things like that may not work in the app, knowing someone had already emailed me about this and we adjusted it. So, but I'm always like super excited to get feedback, good or bad.
Great. Thanks so much. And it looks like that is our last question. I want to encourage everyone listening to check out Flutter social media. They do such a beautiful job and share inspiring things. I really enjoyed following along now. But and I want to thank you, Kristy, for spending the evening with us tonight and for sharing with us.
Thank you so much. I'm really honored you asked me.
Great. Thank you. Well, the video recording of this will be up on our Facebook soon, so everyone please share it with your friends. And we will see everyone next month. And another big thank you to Kristy.
Great, guys. Thank you.